Great. Okay, welcome to our CEG webinar. And this webinar, we're going to be giving you an update on the QOF for 2020 to 21. The presenters are myself, Jo Tissier, and I'm a senior facilitator at CEG, and we've got Britt Keller, who is also a facilitator at the Clinical Effectiveness Group. A bit of housekeeping to start. We are going to record this session, and then it'll be available via our website. Questions we'd like in the chat. We're going to mute everybody, but at the end, if you did want to ask a question, then you can unmute yourselves. We're also going to put in the chat, Lacey, I think this is right, isn't it? We're going to put in a link for a feedback form so that you'll be able to just click on the link and be able to give us some feedback about how you felt the presentation went. And I think if there's other presentations that you would like CEG to do. I'm now going to pass over to Britt, who's going to start the presentation, and then I will come in about halfway through. So thank you very much.
Thank you, Jo, and good afternoon, everyone. As Jo said, my name's Britt Keller, and I am the Primary Care Facilitator for Newham. So let's get started. So just a quick overall of what we're going to cover today. So I'll be taking you through the quality and outcomes framework. So that'll be any amended indicators, anything that's staying the same, etc. We're going to touch on PCN investment and impact fund, which came out this month, and also very briefly on vaccinations and immunisations. So if you look at this pie chart, this shows you how the points are split this year. As you can see, the bulk of the points are towards what's called income protected indicators, and the remaining 183 will be performance based. So that's divided up into your 74 points for quality improvement, 58 for IMS and screening, 81 for disease registers, and 44 for your prescribing indicators. And we'll go into more detail in that. So let's begin by highlighting the indicators that are based on practice performance. So within those areas, immunisation covers flu immunisation covers 4 indicators. You have 2 for cervical screening. There's a number of them for maintenance of disease registers and for prescribing areas as well. So these are the areas that the flu indicators cover. As you can see, it's COPD, diabetes, stroke, TIA, and CHD. Now, what the point to note here is that in line with the pandemic, and to really highlight the seriousness of making sure that everybody gets vaccinated this season, the points have been doubled. But also there's a payment threshold. The lower one also accrues points. So if you were only able to vaccinate 57% for COPD, you'd still earn 3 points this year. Got a number of tools available to support practices. You may already be familiar with our adult immunisation CEG template. Some of you will have that in your boroughs within the LTC template. We've got a number of EMIS CEG flu searches, which hopefully you're all using. There's a weekly flu dashboard, which is available on our CEG website, and also we're supporting those webinars. Some of these resources may differ from borough to borough, but if you get in touch with your primary care facilitators, they will be able to point you in the right direction, and contact details for them will be at the end of the presentation. So these are the cervical screening indicators. So the indicators themselves haven't changed, but again, like flu, the points allocation has doubled, and also you will accrue points at the lower payment thresholds, and that's a total of 22 points. Now we have our disease register indicators, and this totals 81 points. So basically what's happened is, with the pandemic, it may be that, the coding isn't picking up, patients haven't been screened. So what you need to do is you need to maintain your disease register so that they're comparable to 2019, 2020 levels. So, the reasons for this could be that patients have got a new diagnosis of a long-term condition. They may not have been for diagnostic tests, so these diagnoses haven't been confirmed. So it's just to look at that activity and to make sure that everybody has got a diagnosis. There's also some changes to asthma COPD register, and you need to maintain a register for patients with a BMI of 30 or more in the last 12 months. And to support practices with those resources, we've got some prevalence improvement searches, which you can find in our folders. Again, the actual look at this from borough to borough, so please do get in touch if you aren't able to locate them easily. We also provide monthly CEG practice clinical trend reports, and these are available on our website too. Okay, so the next two slides, we're going to just briefly look at the prescribing indicators, and these are all within their individual clinical domains. So the total points will be 44, and these are in the areas of AF, CHD, there's 2 for heart failure, stroke, TIA, and the last 3 are in the diabetes domain. Now we're just going to have a little overlook on the income protected indicators, which, as you know, makes up the bulk of the points this year. Now, to achieve these, payments will be based on your historical performance for last year, although it will be monitored via CQRS. But as I say, that's just for monitoring, it won't be for payment purposes. Now, to be eligible for payment, you will need to agree a plan with your CCG to do some patient prioritization. So you need to look at the patients who would be at greatest risk from COVID. So that would be potentially your BAME communities, any patients who are at risk of harm from poorly controlled long-term conditions, or those who have a history of missing reviews. You also need to commit to referring to any weight management program that your borough will put on. And just to note as well that even if you've had a PCA in place, which is a patient, I've forgotten what it's.
Care adjustment.
Thank you, Joe. Mind went blank there. Yeah,
Don't worry.
if you've got one of those in place, which used to be the old exception reporting, those alerts will not come off for the patient, because what they're looking to see is if anybody comes in opportunistically, if you've got the alert there, you know, you could carry out some kind of review on them. So again, resources for risk stratification to help you prioritize your patients. We've got a folder of searches we've done in conjunction with UCLP, and these are in the areas of diabetes, hypertension, COPD and asthma. We have APL tools available on our website, and this one specifically for CVD. And you know, in your own localities as well, you may have your own risk stratification searches that your facilitators have put there for you as a CCG. And this is just some of the areas that I've just spoken about. So you've got your UCLP searches there, you've got your tools, this is what the tools look like. Again, if you need any you know, help with this, please do contact your facilitators. Okay, we're moving on to the 3 clinical domains, which have got some amended or new indicators, and these are in the areas of heart failure, asthma and COPD. For heart failure, they're looking for a diagnosis made after the 1st of April that must be confirmed by either an echo or a specialist assessment, either 3 months before or 6 months after the diagnosis was made. Just to note here, if your patients were newly registered in the last 12 months and there was no confirmatory diagnosis, you have 6 months from the date of registration in which to do that. They're also looking for heart failure patients with LVSD to see whether they're treated with a current beta blocker. And your review will also include a medication review and an assessment of functional capacity. So this last bit's new. Moving on to asthma, your register will now be from age 6 and over. And again, similar to heart failure, the diagnosis will be after the 1st of April this year, and that has to be confirmed by spirometry and either reversibility or a variability 3 months before or 6 months after the diagnosis. And again, you know, if they were newly registered in the last 12 months, look to see whether that was confirmed. And if not, you have 6 months from the date of registration to do that test. So the review for asthma will include an asthma control questionnaire, inhaler technique, the number of exacerbations, and a personalized written asthma plan. Smoking status will now also include passive smoking, so any secondary smoke, especially for children, and you must offer support for those households. Okay, COPD. So this is looking at patients either diagnosed before April or after the 1st of April this year, and that they have had a confirmation spirometry, FEV1, FEV ratio below 0.7. And again, either 3 months before or 6 months after. And again, if they were newly registered within the last 12 months without this confirmation, please make sure you do that within 6 months of registration. And also to note if the patient's unable to take spirometry for any reason. The rest of the review will include the number of exacerbations and MRC scale. Now, this is a totally new domain and it's worth 18 points. This is non-diabetic hyperglycemia. And all you need to do to achieve this is keep a record of patients aged 18 years or over with a diagnosis of non-diabetic hyperglycemia, and just ensure that they have a HbA1c or fasting blood glucose within the preceding 12 months. And you know, that should be fairly easy to do. Okay, I've finished my my section on QOF, and I'm going to hand you back to Joe now, who will talk you through the cancer QI. Thank you, Joe.
Okay, I think there's just a couple of things actually just to highlight before I go on to the quality improvement and what it has been saying. You might have noticed that in the EMIS, I don't know if this is the same for the System 1 practices, I'm not so sure about this, but EMIS have released they've done the QOF updates based on the business rules version 45. And it's been highlighted to us that some of the stuff that Prit talked about, for example, the asthma indicator. So one of the asthma indicator that's to do with the review, and for the review you have to do the asthma management plan, assessment of inhaler technique, can't quite remember the other things actually that were on there. But the descriptor for that indicator says an assessment of inhaler technique needs to be done. But actually, when you look at the business rules, there's no code for inhaler technique. So there's a little bit of lack of clarity with regards to the rules and some of the indicator descriptors. The same for the new indicator to do with heart failure, where they say an assessment of function, and normally that would be NYHA. But again, if you actually look at the business rules, there isn't the code there for NYHA. Now, as Prit said at the beginning of the presentation, that actually most of the indicators in QOF this year are income protected, and the ones that you have to show practice performance on, these are not in those lists, they're not in the list. However, I just wanted to highlight it because you might get a little bit confused. You know, you might think, well, the template doesn't seem to asterisk inhaler technique. The script the indicator says we should be doing inhaler technique. I look at the business rules and there's no code technique. So I wanted just to flag it up because we are raising where there's lack of clarity with NHS England, QOF, to kind of get a little bit more information about this. And when we do, we'll be able to, again, feed that back to practices. The other one is about spirometry, and on the asthma and on the COPD, for your newly diagnosed asthmatics in COPD, they are requesting for spirometry plus another objective test. Now, because of the pandemic, spirometry is not necessarily being done. The only suggestion I've got at the moment for that is that there is a PCA that says service not available. So that is a PCA that can be used. Again, I did have a quick look at the business rules and can't see that in the business rules, but we will we will flag that up with NHS England. So I suppose what I'm saying is that there does seem to be a little bit of lack of clarity. However, the practice performance indicators are not the ones that I'm talking about. Hopefully that makes sense. If it doesn't, we can maybe come back to this at the end. And also just mentioned the flu and the flu webinar. It's just we do have a webinar tomorrow on flu, so if people haven't been able to get to one, there is one tomorrow, and they will also be on our website, so you'll be able to see them if you can't see them at all. Okay, I'm going to move over to the QI domain. So just to remind practices that the QI domain for last year focused on medicines management and end of life. And the QI domain for this year focuses on learning disabilities and also the early diagnosis of cancer. And for this year, there are points available, so that will be on practice performance. And there are 37 points for each of the domains. So 37 for early diagnosis of cancer, 37 for learning disabilities. I'm not going to focus on the learning disabilities quality improvement domain because we have a focused webinar on learning disabilities. So it's only the cancer one that I'm focusing on. The cancer QI originally focused on improving participation in national screening programs and improving referral and safety netting. And it might be that your localities, I know I come from City and City and Hackney have already done some work on this, have already contacted practices to support you on what you're doing with the QI. And it may be that they focused on stuff that was originally sent out in April. You haven't been doing work due to the pandemic, there has been a refocus on a set of national actions, which I'm going to go through. So just to remind you, there's two parts. You get 27 points for your QI work, and you're going to get 10 points for participating in network peer review meetings and sharing what you're finding. So next slide, please. So the national actions for QI, that when I'm talking about the refocus, is that they're saying focus on restoring the cervical screening program, proactively engage with patients that screening can be accessed safely, monitor suspected cancer referral rates, and ensure that your practice has a proper system in place for safety netting. Next slide, please. Just a little bit more about the systems. It's looking at who's been placed on urgent referral pathways, proactively follow up those who do not attend any of their appointments. You might have lists of patients who weren't referred due to level of risk and or patient concern, patients who were referred urgently but were downgraded with the consent of the primary care professional. Next slide, please. You all right, Prit? Can you get the next slide? Oh, thank you. Just a word about QI. Quality improvement, remember, is all, you'll probably remember this from last year, but it's looking at assessing the area in your practice organisation that requires improvement, generating some baseline data, then deciding on what improvement that you're going to do. You plan and you test it, and you test your intervention to see how you've done over the period of time. So if you don't know too much about the quality improvement model, we've put a link in our resources from the RCGP, which very succinctly describes quality improvement. Next slide. So the questions at the end of the year that you will need to fill in for your quality improvement domain are, I don't know how clearly you can see them, but I'll read them out very quickly for you. Or what issues did the practice identify with the quality of referrals for early cancer diagnosis? What actions did the practice take to build confidence in primary care, reassure patients that general practice can be accessed? What actions did the practice take to support restoration of the cervical screening program? What changes did the system for safety netting? How many patients who had not attended any appointments were proactively followed up? What changes will have been embedded into practice systems to ensure early cancer diagnosis in the future? And if applicable, how did the network peer support meetings and patient participation group influence the practice QI plans? So that's what you would need to be answering at the end of the year. Next slide, please. So these are some of the ways that you might answer some of those questions. You might look at your 2-week referrals. So your fast track referrals, you might look at a sample of those and you might review against NICE recommendations and actually see how well did they meet the NICE recommendations. You could do a little bit of quality improvement on that. The question around building confidence, you may decide to put up in your practice, you might put up posters, you might be sending text to patients about surgery, etc. You'd be able to say that's what you did for that question around building up confidence. Cervical screening. Well, you could run the searches on patients who are overdue for your cervical screening, and you can then contact them and proactively contact them. Safety netting in your practice, you may be able to run searches on patients who didn't attend the clinic, who haven't been seen, and then you'd proactively follow them up, and you could look at your numbers of how many hadn't been seen and how many you're following up. And for looking at maybe reviewing your early cancer diagnosis, there's Public Health England called fingertips data, and that will give you a kind of data on your own practice and your own early cancer diagnosis, and then you could review what happened to see how your practice is performing. Next slide, please, Britt. So there are a number of national resources to support you with this. EMIS searches, you've got the EMIS searching searches on cervical. As I mentioned, there's the fingertips website, and we've put the link in there. And just the second link that I've got there, which is the YouTube one, is quite a useful, very short video on how to actually use that fingertip data. Then for the PCNs, there are from Cancer Research UK, there are facilitators who you could contact to actually also support you with this. And I mentioned the Quality Improvement Toolkit, and that will detail really all details around quality improvement. Macmillan produced a cancer template, which you will find in EMIS. They also produce a suite of searches, which will tell you which patients have not been seen in the fast track clinic. So it is worth looking at those. What we will do from CEG is that I'm hoping to do like a little fact file, so that we'll be able to give you a little screen to find these. Next slide, please. Okay, so that's a bit about quality improvement for cancer. I just wanted to mention the PCN DARES Investment and Impact Fund, because this is running for 6 months and it's starting in October. And it's a bit like QOF in a way, because you're getting points and finance for the points. So there's 194 points, £111 per point. And you'll notice that it's another funding stream for things like doing your seasonal flu, 72 points, your LD health checks. So the learning disability health checks may be part of a local enhanced service, but they're also part of your QOF quality improvement domain. Then you've got your referrals to social prescribing, and that will link up to your PCN social prescribers. Then you've got 3 medicine safety indicators, 50 points, and these are all about gastroprotective medicines when giving out non-steroidals or with anticoags and antiplatelets. Next slide, please. Actually, sorry, just one other thing about the investment fund is that we've also got a suite of searches, the PCN Investment and Impact Fund searches. So we'll, at the moment, we've got them in EMIS, and we'll have to have a little think about how we're going to do them for System 1. But they will be able to show you how well, as a PCN, you'll be doing on these targets. So there'll be useful searches to look at. Next slide, please, Brett. The final thing we really wanted just to flag up very briefly is the payments for vaccinations and immunisations. There was a major overhaul really on the payment model for looking at vaccinations and immunisations. And from April, it's become an essential service. It's been rolled out over the next 2 years. And for the first year, it's MMR. So MMR are becoming an item of you need to get 50% coverage. The second year, so from April onwards next year, that'll link to all childhood vaccinations. So they are an essential service. And another essential service is the postnatal check, the 6 to 8 week check. So there's been extra funding for this through the global sum. It might be, again, that your locality in an enhanced service, you're already doing postnatal checks. Again, I'm not too sure what happens in other areas, but in City and Hackney, that is part of an enhanced service. So again, it's like another funding stream for those checks. I think that's the end of the presentation. Can I just see the next slide? So we've gone through, we've actually have kind of covered quite a lot of stuff here. We've talked about the APL CVD tools. We've talked about things like UCLP, risk stratification searches. We've talked about what else? Yeah, the searches for the investment and impact fund. We have facilitators to help you with this. So if you don't quite know what we're talking about when we talk about an APL CVD tool, but think actually we would quite like to look at it because we are interested in doing some risk stratification, then we would advise you to get in contact with the facilitators, your locality facilitators, who will be able to give your practice some support and where to find these tools and how to use them. Also, we've got our website address there, so please do look at the website because, as Prit mentioned, there are flu dashboards that are coming up. You've got dashboards about prevalence in your practice, so please do look at our website and become familiar with where these data reports are. Next slide. I think that is the slide we're going to look at questions. Oh, this is just some resources. When we talked about resources, just the first one is around the GP contract. So you'll be able to get a bit more information about the QOF indicators. And if you wanted to have a little bit more about which ones were the protected ones, which ones are the ones that we've got practice performance, it's all in that document highlighted there. And in the second one as well, that's the updated guidance. And then the other one is on the early diagnosis of cancer. We've got a few minutes left. Have we got questions? Shall I have a quick look at the chat? In the chat?
So I've got one from Nicola. It says, what about the fact that spirometry has not been possible until very recently due to COVID?
Yes, that was the point that I kind of made up and said that there is a PCA, that says service not available for spirometry. And although, as I said, when I looked at the business rules, I couldn't quite find that in the business rules. That is something that we'll flag up with NHS England about the QOF.
And I have one more. It says, good afternoon. Is there any search available for PCN DES IIF?
Yeah, so that's the Impact and Investment Fund. And we're just about to publish the suite of searches for the PCN Investment Fund. So they'll be coming out and you'll see them in the next few days. So you'll be able to see how your practice is doing for this PCN Investment Fund. But as I say, they link very much to all the other funding streams as well. That's all I've got to say, actually. We're coming to the end of the time. I hope that, we did cover everything that you were hoping to hear in this webinar. We've got another webinar following straight afterwards, actually, which is about the structured medication reviews in care homes. So, Lacey, can people join now, or is that? Oh.
Yes, if you've signed up for it, you should have received the link by now. Please let me know if you haven't. I've also attached in the chat function for you the feedback form. If you could generously fill that out for us, we'd be most grateful. And I've also attached the web link for our resources for you as well.
So just thank you so much for your time this afternoon, and I do hope that you found it useful. Many thanks.
Thank you.
Can I just ask, do we stay on here for the next one, or do we need to log out and log back on?
You'll need to log out and log back into the next calendar invite you should have.
Lovely, thank you.
Thank you very much, guys.